So pleased to be here today to talk about Bill 4, the Alberta Healthcare Insurance Amendment Act 2022. And this act bill is really quite straightforward. It's part of the government's commitment to a collaborative relationship with physicians focused on partnership and innovation. The bill proposes repealing Section 40.2 of the Alberta Healthcare Insurance Act. This section of the Act allows government to terminate compensation-related agreements, such as the one we had with the Alberta Medical Association. This legislation is no longer required given the terms of the new agreement that we have reached between the Government of Alberta and the AMA. I am very pleased that over 70% of voting physicians supported this new agreement. With its concrete solutions and significant investments, the new agreement will address the unprecedented pressures facing Alberta's health system, target areas of concern, and support Albertans' healthcare needs. Albertan physicians will continue to be among the highest compensated in the country, with an average increase of 4% over the 4-year term of the agreement. The new agreement puts a strong priority on primary health care, including a sliding scale of rate increases, with the highest increases for family physicians at 5.2%. Lump sum increases will be given to primary care networks of $20 million in each of 2022-2023 and 2023-2024. And this is being done to provide additional support for primary care while the Modernizing Alberta's Primary Health Care System panel work takes place. With additional targeted spending, including new supports for rural physician recruitment, spending on family medicine overall will increase by 8% over 3 years. While much of the increase will be provided directly to family doctors, targeted funding will go to programs like the Rural Remote Northern Program, the Recruitment and Retention Program. These programs directly benefit family doctors to help with the increased business costs that they are experiencing right now. About $750 million in new funding over 4 years is being invested to stabilize the healthcare system, including $260 million in targeted funding. This targeted funding is going toward physician recruitment and retention, incentives for physicians to work in rural and remote northern communities, physician support programs, and funding to assist physicians with business costs. We recently announced details on an agreed-upon 1% rate increase for physicians in each of the next 3 years and 1% recognition lump sum payment for the exceptional contributions made by physicians during the pandemic. This lump sum payment is worth approximately $45 million, or about $4,000 per physician. It will go to the AMA by the end of this calendar year for distribution to their members. We are also working with the AMA to implement the 1% rate increase for fiscal year 2022-23. The increase applies to fee-for-service and alternative relationship plan rates, providing an additional $46 million to physicians. As outlined in our new agreement, the rate increase is heavily weighted for specialties facing the greatest pressures. We are working with the AMA to distribute these increases across all doctors, including specialties. And they will be effective April 1, 2022, and are expected to be finalized and paid out by March 31st, 2023. Now, the first 3 years of the agreement provide rate stability. Year 4 will see implementation of results from a comprehensive market review based on comparisons with Ontario West jurisdictions. There will also be a global rate adjustment in year 4 to reflect general economic and fiscal conditions at that time. There is the potential for binding arbitration for both the market review and global rate adjustments should we not be able to reach an agreement. Additionally, there will be gain sharing in years 3 and 4 of this agreement, where the AMA can receive 50% of any savings achieved by keeping cost growth below population and complexity. This legislation is another step in our relationship with Alberta's physicians to create a collaborative environment founded on mutual respect and trust with innovative ideas for the future. It is a commitment I made in the new agreement with the AMA, and we're taking immediate action through the 4th bill of this legislative session to fulfill the promise that we've made to Alberta physicians.
But thank you for carrying through on the commitment under our new AMA agreement to repeal Section 40.2. This is another important milestone on the road forward with the agreement. In recent weeks, we've seen other signs of progress, such as the lifting of the daily services cap. The AMA appreciates the timely collaboration that we have seen. Government and physicians have a great deal of work ahead together to improve access to care for Albertans and to stabilize physician practices, which are part of the infrastructure of the healthcare system. As for today, with the introduction of Bill 4, we are taking an important further step in rebuilding the relationship between government and the medical profession. When Bill 4 has been passed in the legislature and formally proclaimed, the AMA will withdraw our lawsuit. In the interim, we will remain focused on our main task of delivering quality care to Albertans and advocating on their behalf.